Hi everybody, Dr. Goldson along with Vicky.
Hey.
Vicky and I had a great conversation this morning about a project that she's working on with school, and it's centered around business and chiropractic. And what she found through that research was that a lot of people were afraid of chiropractic, thought they would get themselves hurt, or didn't really know what chiropractors do.
Exactly.
Anything you want to add to that?
Yeah, they were just afraid of being adjusted. They had the misunderstanding of what we do what chiropractors actually do, and a lot of patients are afraid to actually come in because of that fear.
And the key thing is, I love chiropractic. I'm a chiropractor, so I have to. But I love it because it helps so many people. So many people come in and have joint restriction, have pain, discomfort. Forget those who have even just been in trauma, obviously. But chiropractic helps to release the spine of restrictions, tension, and actually help the body move more fluid and mobile. So that's what we're going to go over today. We're going to go over a basic chiropractic session so you can see exactly what goes on behind the door. So we're going to start off with Vicky. I like to stretch first. Lay down on your back for me, please. Because we're talking about a spine, we're talking about pelvis, we're talking about joints, bones coming together. But what really attaches to those bones and joints are the muscles. So if our muscles are tight, we're going to have more restrictions in the joints, and we're going to have actually more dysfunction in the muscles because tight muscles are more readily injured. Just relax for a second. So we do a little hamstring stretch. And all of this to prepare the spine for the adjustment while increasing flexibility within the muscles. Relax. Got you. 3, 2, 1. 3, 2, 1. So Vicky's a student, and she works at a desk job here at Goldson Spine. There's an occupational hazard when you sit down a lot throughout the day. When you're sitting down, your knees are bent, which means your hamstrings are shortened, and when they're shortened, they're going to become tighter. So when you stand up, your muscles are shorter than when you sat down, hence more pressure across the joints because a tight muscle again will cause stress across the joint. So knowing that you have an occupational hazard just sitting down all day, it's always good to get up, and if you can't get up frequently throughout the day, make sure you're stretching at home. Actually, stretching this will prevent a lot of your injuries because, again, tight muscles create restriction. Relax, move to this side. And so while I'm stretching, Vicky, I'm looking for a couple of things. I'm looking at which side is more flexible. I'm looking at, is there any compensating movements? Do I see any signs of pain on her face while I'm stretching her? Do I pick up on any imbalance at this point? Right now, she's actually pretty flexible. I give this a B+. B+. So all the way across, and we stretch different areas of the body. Like now I'm stretching the hips because our hips get really tight, and actually our hips are a cause of a lot of our dysfunction and pain, especially the pain that goes down our legs like sciatica. A lot of that usually has to do with tight hip muscles. And just relax. 3, 2, 1. One more. 3, 2, 1. All right. All right, so now we're ready to move some bones. All right. Okay. As we talk this out, chiro and chiropractic means by hand. So our hand is our primary tool. So right now I'm just looking for restrictions in Vicky's neck. Right now I see some on the left, just between left and right, the vertebrae between 3 and 4 are a little stuck. So I'm going to rotate, apply a little pressure, and move it. So that release between 3 and 4, coming back on the right side, she's right at 5 and 6. So again, very similar. And that's why you don't have to be afraid of chiropractic care. Because what you've seen in the movies where somebody stands up, comes behind a guy and rips his head off and he drops to the ground is not what chiropractic care is. Chiropractic care is within your anatomical range of motion, which means if you can turn your head this far, the adjustment is not going to take you past that far. Okay? All right, do me a favor. Now I'm looking at her pelvis. Her imbalance is there. I see that we're a little bit off on that right side, so I'm going to have her turn to the side face me, please. I'm going to take this hand, roll the shoulder up. Let this hand relax on top. Give me this leg for me, and just relax. Keep that arm relaxed. I got you. Let it go, let it go. I'm looking for a pelvis right about here. That's where it's stuck. And let it go. Good job. Give me this hand right here. Hold the shoulder up. Good. Let the hand relax. And just relax that right there. I got you. Good. Just relax. Good. So Vicky's doing a good job of relaxing. Good job. And why that's important is if you relax, I can drive through the joint, the muscles get out of the way, there's less discomfort, there's less pain. Last thing, come on up, sweetheart. All right, you stay right there. So now we're looking for another occupational hazard for people that work at desks, is the rounded back. Sit like this very often, you're gonna get a rounded back, so we're gonna attack that area. This is effective for a lot of people because a lot of people get stuck in their mid back and they just function around it. So just relax your shoulder for me, please. There you go. Tuck your chin down for me. Keep your chin tucked. I got you. Keep your chin tucked. There you go. Going back down together. Let it go. Let it go. Good job. Beautiful. Stay there for a second. It's not that we're just moving bones. We're actually impacting the nervous system. And chiropractic is not just about joints. It's actually getting the nervous system from the brain connected to the rest of the body and back up in sensation to work as best possible without interference. So again, this is what chiropractic adjustment is. It's been great showing you. If you need a chiropractor, we're here at Goldson Spine to help you. 4 locations, 866 Goldson, 866-465-3766.